Before I start this video, I'd like to take a quick second to define some terms to help avoid confusion. The term coronavirus technically means a family of viruses that can cause upper respiratory illnesses in humans, such as the common cold or the 2003 SARS outbreak. COVID-19 refers to the new or novel coronavirus outbreak that began in Wuhan, China at the end of last year. So COVID-19 is one virus under the umbrella term coronavirus. However, I may use the two terms interchangeably in this video. I'm going to do my best to be accurate because unlike Kent, I don't want to spread misinformation, so if you see something wrong, please leave a comment.
Anthony wrote in, International group of medical doctors call COVID-19 a hoax. Now, I said months ago the COVID-19 thing is probably just a flu and is a hoax and is an excuse to get everybody to wear a mask or to see how much control they can have over you. And I said, if this doesn't work, well, they'll go to COVID-20 and then COVID-21 and COVID-22. It'll keep going. They have a goal in mind, okay? And it's not the health of the people. Anyway.
Who are these alleged medical doctors? What's your source for their claim? What exactly are their qualifications? Even if I grant you that there's a handful of doctors who say it is a hoax, I guarantee you that the overwhelming majority of doctors and virologists know it is not a hoax. So on one side, we have the consensus of medical experts who say that COVID-19 is very real and precautions like social distancing and masks are imperative. And on the other side, we have Jim Jones wearing a Hawaiian shirt, reading a YouTube comment, and presenting that as factual information.
The quote is, we also state that COVID-19 should not be on list A for any longer because we now know that it is normal flu virus and the normal flu virus isn't on list A. The panic is created by these false positive PCR tests. 89 or 94% are false positive.
The test he's talking about here is called the RT-PCR test, and the name is an abbreviation for reverse transcription polymerase chain reaction test, and it's considered the gold standard. The RNA of the virus that causes the disease is detected through this test. Now, false positives can happen, but they're very rare. According to Harvard Medical Blog, the rate is at less than 5%. False positives can be caused by cross-contamination after samples have been taken, and with so many people getting tested, some labs are better than others, and mistakes do happen. However, I think it's just ridiculous to say that 90% of the tests are false positives.
They don't test for COVID-19, and also the rest is false negatives, so we have to look at clinics. Medical doctors have to stop looking at those tests. That's very important. Let's go back to the claims and to the facts.
If they're not testing for COVID, then why does it matter that the tests aren't accurate? And what are they testing for then? Why would they be testing for anything else?
I think you'll find about the same number die every year of the flu. Usually the elderly or the sick. So I've never been a believer that it's anything you need to panic over. Okay.
So are you saying that the flu isn't that dangerous? Why do you think that that is? Is it because people can get flu shots? You know those are vaccines, right? Aren't you an anti-vaxxer, Kent? Maybe that's not it. Kent probably doesn't get flu shots either. It's easy for people to think the two are similar because they are in certain ways like the early symptoms, but COVID is much more dangerous because it tends to not only do damage to the lungs like the flu does, leading to pneumonia, but it can also cause organ failure for like the kidneys, heart attacks, and blood clots, which can lead to strokes. Influenza tends to kill by either turning the body's immune system against itself, so it destroys tissue where the virus takes hold in the respiratory tract, and this leads to hypoxia, or by causing a bacterial infection in the body, leading to sepsis. COVID is more contagious. It can kill you in many more different ways, but the thing that really makes it more dangerous is how much longer the incubation time is. If you get sick with the flu, you'll know pretty fast, and you're likely to call in sick to work and see a doctor and avoid other people. But COVID-19 can leave you asymptomatic for up to 2 weeks before you know that you have it. Now, it's tricky to calculate the exact death toll for COVID based on a number of factors, And we've had numbers for the amount of flu deaths each year for much longer, but this statement is just obviously wrong. The best estimate I could find in terms of simple numbers was that globally around 600,000 people die from influenza each year. 2020 isn't even over yet, and the death toll from COVID is at 1.1 million. Dr. Fauci has been quoted saying that COVID is 9 to 10 times more deadly than the flu. What Hovind is saying here is obviously demonstrably wrong, and it's dangerous. Because a staggering 44% of Americans don't see COVID as a legitimate threat. Most Republicans that were surveyed, 59%, believe that the death count is inflated. 1 in 3 Americans think the same thing. Kent Hovind, like it or not, has influence over a lot of people. For some reason, people see this moron as an authority figure. And when you have someone like him spreading misinformation, people don't take the pandemic seriously. They don't wear masks, and they're not exhibiting social distancing. And these same people might get sick, and then for 2 weeks show no symptoms at all. They're also less likely to get tested, spreading the disease and speeding up the rate of transmission. I thought when Trump got diagnosed with COVID, Kent Hovind would either address it as a conspiracy theory, saying that he didn't really have it, or would at least shut up about the topic. But this cult leader continues to spew dangerous misinformation, and it's putting everyone at risk.
You can forget COVID. School has begun. You need to vaccinate them against evolution.